Welcome to our channel. Today we delve into the harrowing experiences of individuals who continue to suffer from long COVID and the significant negative effects some have faced from the COVID-19 vaccinations. COVID-19 has impacted millions worldwide, but for some, the journey didn't end with a negative test result. Long COVID, also known as post-acute sequelae of SARS-CoV-2 infection, PASC, is a condition where individuals continue to experience symptoms weeks or even months after the initial infection. These symptoms can range from fatigue and brain fog to more severe issues like heart palpitations and respiratory problems. Scientific research has shown that long COVID affects many of those who have recovered from COVID-19. A study published in The Lancet indicated that more than half of patients reported at least one symptom 6 months after recovery. This is not just a physical battle, but a mental one, as these prolonged symptoms disrupt daily life, work, and emotional well-being. For example, Sarah, a 35-year-old mother of two, contracted COVID-19 in March 2020. Initially, her symptoms were mild, but as the weeks turned into months, she noticed she couldn't shake off the exhaustion. Simple tasks like walking her children to school became monumental challenges. Sarah's story is just one of many. Studies show that symptoms like hers, ranging from fatigue to neurological issues, can persist for months or even longer. This has led to a significant impact on the lives of those suffering, affecting their ability to work, take care of their families, and enjoy life as they once did. Similarly, while COVID-19 vaccinations have been a critical tool in controlling the pandemic, helping to reduce hospitalizations and deaths, there are cases where individuals have experienced adverse effects. The majority of vaccine recipients report mild, short-term side effects like sore arms, fever, or fatigue. However, there are cases where individuals have faced more serious complications, such as myocarditis, blood clotting issues, or neurological symptoms. For instance, John, a healthy 28-year-old, received his second dose of the mRNA vaccine and felt fine initially. However, a few days later, he began experiencing chest pain and shortness of breath. After visiting the emergency room, he was diagnosed with myocarditis, an inflammation of the heart muscle. While this condition is treatable and John is on the road to recovery, his experience is a stark reminder of the complexities and risks involved. It's crucial to understand that the vast majority of people have had positive outcomes from vaccination, contributing to the collective fight against COVID-19. However, every single adverse case is tragic and underscores the importance of understanding these side effects better. We need more research to delve into the underlying causes of long COVID and vaccine-related complications. Understanding these mechanisms is the key to developing effective treatments and ensuring the safety and well-being of all individuals. Researchers are currently investigating the potential roles of autoimmunity, viral persistence, and inflammation in long COVID. Similarly, studies on vaccine side effects aim to identify risk factors and preventive strategies. Research into long COVID has revealed some intriguing, albeit troubling findings. For instance, some researchers suggest that remnants of the virus might linger in the body, continually triggering immune responses. This could explain why some patients experience ongoing symptoms long after the initial infection has cleared. Additionally, there is a growing body of evidence suggesting that long COVID may involve a form of autoimmunity, where the body's immune system mistakenly attacks its own tissues. Consider the case of Emily, a 42-year-old who was an avid runner before contracting COVID-19. Post-infection, she experienced severe joint pain and was diagnosed with what her doctors termed a post-viral autoimmune response. Her body's immune system, which fought off the virus, now mistakenly targets her joints, causing persistent pain and inflammation. Emily's experience highlights the complexity of long COVID and the need for specialized medical care and research to understand and treat these symptoms. On the other hand, vaccine-related complications, though uncommon, are equally concerning. There are reports of neurological symptoms following vaccination. One such case is Robert, a 50-year-old teacher, who developed Guillain-Barré syndrome, a neurological disorder shortly after his vaccination. GBS causes the body's immune system to attack its nerves, leading to muscle weakness and sometimes paralysis. Robert's condition required intensive medical treatment and rehabilitation. While cases like Robert's are not widespread, they emphasize the necessity for ongoing research and vigilance in monitoring vaccine side effects. It is also essential to address the psychological impact on those suffering from long COVID and vaccine-related complications. Many individuals report feelings of anxiety, depression, and frustration due to their prolonged and unexplained symptoms. The lack of clear treatment pathways and the often ambiguous nature of their conditions can exacerbate these feelings. Mental health support is a crucial component of care for these individuals, helping them cope with their symptoms and improve their overall quality of life. Take Maria, a 29-year-old graphic designer, who after a mild COVID-19 infection, began experiencing severe brain fog and memory issues. She found it difficult to concentrate at work, leading to decreased productivity and mounting frustration. Maria also struggled with anxiety, fearing that she might never fully recover. Her story underscores the importance of comprehensive healthcare that includes both physical and mental health support for long COVID sufferers. Moreover, the societal impact of long COVID and vaccine-related complications cannot be overlooked. These conditions often result in prolonged absences from work, increased healthcare costs, and a need for long-term support and rehabilitation services. The economic burden on individuals and healthcare systems is significant. Governments and health organizations must invest in research and resources to better support these individuals and mitigate the broader societal impacts. Community support and awareness are also vital. Many long COVID patients and those with vaccine-related complications feel isolated and misunderstood. By fostering a supportive community, both online and offline, we can help these individuals feel less alone and more understood. Sharing experiences, offering practical advice, and providing emotional support can make a significant difference in their lives. As we continue to learn more about these conditions, it is crucial to maintain open communication between patients, healthcare providers, and researchers. Listening to the experiences of those affected can provide valuable insights and guide future research and treatment strategies. This collaborative approach can help us better understand the full scope of long COVID and vaccine-related complications and develop effective interventions. In conclusion, while we celebrate the victories in our fight against COVID-19, we must also stand with those who continue to struggle. Their stories are a stark reminder that our battle is far from over. We need to invest in research, support those affected, and strive towards comprehensive healthcare solutions. The journey of understanding long COVID and vaccine-related complications is ongoing. As we gather more data and insights, it is crucial to maintain a balanced perspective. Recognizing the benefits of vaccination while also acknowledging and addressing its risks will help build public trust and promote informed decision-making. Thank you for watching. Don't forget to like, comment, and subscribe for more insightful content. Stay informed, stay safe.